Hello, and welcome to another episode of Two Moms and Some Labels. Two Moms and Some Labels is a platform for parents and caregivers caring for a child with a disability to come together and share information, gain ideas on how to persevere through challenging times. My name is Brittany, and today on this episode, we are going to talk about everything OT. OT meaning occupational therapy. And with me, I have a very special guest, and I'm going to let her take it away and introduce herself.
Thanks, Brittany. My name is Jennifer Nitz. I'm an occupational therapist, and I own a business called blossom.and.grow.ot. I'm based in Jacksonville, Florida, and let's talk more about OT.
Yes. Okay. So first, before we even get into what OT is and everything, what made you even get into, this field of work, becoming an occupational therapist?
Yeah, so in high school, we had to get volunteer hours for Bright Future Scholarship. And I actually volunteered at an occupational therapy clinic in my hometown. It was a private clinic that was, they did sensory integration. And I loved it. I loved volunteering there. It eventually turned into a job. I did one of my field work rotations there. I love the OT that I worked with. And I always just thought like playing with kids would be the best job. Like that just makes me so excited. So that's when I decided I was going to do it in high school. And I stuck to that and went to school. And yeah, so just really, really love the idea of playing with kids. So.
Cool. So you only work with kids?
Yes, currently I do. Previously, I have worked with adults.
Okay. And so, like, what ages do you work with?
Yeah, so I work with 0 up. Like it just depends upon the child's goals and a couple other things. But just mainly it's pediatric therapy. I haven't had anybody that has been like over the age of 18 ever reach out or anything so far, but really it would just be based on goals and what the family wants to work on with the child.
Okay. And so, all right, you went to school and you picked this up helping out and school, and then you just loved OT. You fell in love with it.
Yeah.
And so now, what is OT? What does that mean? What is the purpose of OT?
Yeah, so occupational therapy addresses daily occupations. So that could be brushing your teeth. It can include getting dressed. It can be play. It can be learning how to walk to the living room because that's what you really want to be able to do. It could be handwriting, coordination to get back into like a team sport. And so much more. It really just is based on the occupation that you're trying to address. So.
Okay. And so if, parents are, working with their child, or they're seeing some things that they feel like maybe they're not developing on track or meeting milestones at certain times, or ages, what do they need to do? What are the signs that are like the real true signs that say, yes, your child needs to go and get OT? How do they know what those signs are, and what are those signs?
Yeah, so I think like as a parent, you kind of had an instinct and a feeling that something's off. So I would, as a parent myself, I'd probably talk to my friends and family first and be like, this is what I'm seeing. Do you have any, tips, things like that? But then I think the best thing to do would be to talk to your pediatrician about, developmental milestones and things like that, where their child falls. And then you could talk to your physician also about getting a referral for occupational therapy. So.
Okay. And, after you talk to the pediatrician, like what is, one sign or one example of something where like a parent should maybe be really concerned, or even go to the pediatrician and say, I think that my child needs to have OT. Like, what
Sure.
is an example?
Yeah, so I can give a couple examples. So one would be, let's say, a really picky eater. Like the child will only eat chicken nuggets from McDonald's for 2 meals a day, and then the other meal is a puree pack, and they just cannot break the habit. There may be some sensory issues going on. There may be some difficulty with following directions and social interaction, things like that. The other thing would be if the child is falling behind in school with handwriting skills, they're having a really hard time keeping up with their peers. Their work is not like the grades, even in kindergarten and stuff. Even with my son, they seem to be giving grades. But if you're finding that, formation of handwriting, when they're bringing home their worksheets, you can't understand what they're writing. They're not coloring in the lines. They can't cut out worksheets. Those are some of the red flags that I would say would be that I would want to talk to my pediatrician about. It could also be just even coordination and balance and not being able to put on their shoes. They fall over every time they try to put on their shoes, or they aren't organized enough to find a shirt in their drawers in their room after mom has told them 10 times to go get them. So.
And so you mentioned that you worked with birth to 18. So going to birth 1, 2, 3 months, what are the signs at that age that parents are looking at?
Sure. Yeah. So usually around 4 months of age, we should be having really good tummy time, lifting our head while we're prone, which is on our belly. And then around 4 months of age, we also start to reach for toys. If your child isn't doing that, that would be a big red flag. So I would definitely be talking to my pediatrician about that. So.
Okay. And then, all right. So let's get a little bit into what you do at Blossom and Grow, because I think it's a little different than going to, your regular OT at the clinic. Can you, tell us about your business and what you do exactly at Blossom and Grow?
Sure. Yeah. So I actually travel to people's homes to do intensive based therapy. So the family can reach out to me. We chat about goals, and then they would pick 1 to 2 weeks of therapy. I would come to their home and we would work on specific goals that we chatted about. So I specialize in something called dynamic movement intervention, or DMI. I also like to use electrical stimulation, or NMES. I can do taping. I am actually trained in astronaut training. I have a whole bunch of stuff that we can do with your child. And it would just be based on the goals that you are working on with your child.
So what's the difference between, going to the occupational therapist and doing, once a week and, twice a week? What is the difference between the regular or, your typical standard OT and then doing intensive? What are you getting out of doing the intensive therapy?
That's a really great question. So let's say that you are going to see your outpatient occupational therapist. Usually those appointments are once a week, 1 to 2 times a week, based on insurance reimbursement and pay or information. And so if you think about that in the grand scheme of things in the week, the child's really only getting maybe an hour to an hour and a half if it's 45 minutes each session at 2 times a week. So it's not really making a huge difference. There is some research out there that says that the intensity, so being able to see the child for multiple hours a day in consecutive weeks, it can help with boosting those goals for getting the child to have better understanding of the task and creating neuroplasticity, so we have carryover of those skills into daily life. So my model is that I would come to your home every day for 5 days, so usually a week, like Monday through Friday, and we are working on those goals to create patterns and better motor control and things like that. So
okay, so then I would say it's similar to, which is funny because, school's about to start and kids have been out in the summer and enjoying staying up late and, going and sleeping in late. And so now, we're in these last 2 weeks of school, about to start. And so I tell my son, okay, so we have to start our routine over and get back
That's
into
right.
the groove of things. So for these next 2 weeks, we are going to start our bedtime routine as we normally would during the school year, because like you were saying, I think with the research, it said like if you do something for 2 weeks, then it starts to become like a habit.
Yes.
Um,
Yeah.
so that's the purpose of the intensive OT, to, like you were saying, to be able to perform more repetitive and consistent movements for the child.
100%. We want to make it more habitual and easy for the child. So, as we continually practice these things on consecutive days, it does create that neuroplasticity. So, those new neural pathways for carryover to make it much easier for them.
Cool. Yeah. So yes, forming those habits, and even, when we go into therapy for the once or twice a week, and it's always important also too for the parents or caregivers or whoever is taking care of the child to make sure, I always say, you going in and you're observing, you're learning, you're taking everything in so that you can be able to carry this over to when you get home. And
Yeah.
just being a parent of a child with a disability, like we're OTs, we're PTs, we're speech, because you have to carry those things over, because we're, like you said, we're only doing it for 30 minutes to an
Yeah.
hour once or twice a week. And so the child, especially if they have like cognitive delays and things like that, they need that consistent repetitive movements or activities going on so that they can be able to develop and form the habit and get used to being able to perform whatever task it is that they're trying to complete as far as their goals go.
Yes,
So
absolutely.
yeah, that is really important. And as far as like the children that you service, what is like a goal or some goals that some of your kiddos have that you see that need the intensive therapy? Is it like choice, or they really need it? Like, what are some of their goals that you see a lot of with the intensives?
Yeah, so a lot of times the families will reach out to do DMI, so the dynamic movement intervention, which is gross motor based. So we're working on rolling, sitting, crawling, transitioning to stand, walking. Those are the ones that I have seen more consistently that have been reaching out for this intensive therapy. And so goals would be, being able to roll independently in the bed, to have better mobility in the home, independent mobility, because that's so important that these children are able to move in their own environment and access their toys and their home independently. So crawling, walking, transitioning, all of that stuff. Upper extremity wise, for all the time that I worked in Wolfson, I worked a lot on upper extremity and everything. And so now I really want to start offering those type of services too, where we're working on for children that have an involved upper extremity, being able to have that be the best helper hand as possible. So them being able to hold items, grasp items, have better range of motion, things like that. So those are my future goals, but the current goals have been a lot of gross motor based stuff. So.
Okay, and so you were saying children that have what did you call it? Like limited
An involved upper
and
extremity.
involved. Okay. So is that meaning like children that maybe they don't have a lot of control, or like they have a limited range of motion in their upper extremities? They're not able to, really make a lot of use of their upper extremities.
Yes, yeah. So thinking also of children with hemiplegia, so an involved side of their body. So we're working on them being able to grasp and hold something while the non-involved side is manipulating those things. For just being able to have better bilateral coordination. So using both arms to put that shirt on or pull those pants up after they use the toilet, being able to hold their plate while they feed and everything. So, yeah.
Okay. And so you said you're going to eventually move into working with more children that have limited access to their upper extremities.
Yes,
Okay.
absolutely. Yes,
Okay.
yes.
Yeah,
That
that would
is
be
my
awesome.
future
Yeah.
goals. So when I worked for Wolfson Rehab, I worked there for 9 years. The last 2 years there, I actually created a constraint-induced movement therapy program to address some of these things. So what we would do is we would, well, anyway, we would like constrain the non-involved upper extremity, so they're forced to use that involved one, so the one that has limited range of motion and use, so that they're able to have increased sensation and better movement and things like that. So we would do activities that would help increase that range of motion, that manipulation, that isolation, just the use and awareness of that extremity, so that child's brain can make those neural connections that it's there and it can be helpful and things like that.
So I know that, like, I've always been told that, okay, so if you have a child that they have like a preferred hand, arm that they use
Mhm.
when there's certain tasks that they are doing, I guess that are like really important or like crucial, like I'll say like my daughter, she has her device and she uses her button, but
Mhm.
she mainly uses her right hand to
Mhm.
access her button. She
Mhm.
can't really use her left hand that much to access
Mhm.
it. So I was told, like, when we're doing things like that, she's trying to access her communication, that I shouldn't be trying to restrain her um most useful, or I can't think of the word, but her
I know
most
what
useful,
you're saying. Yeah.
yeah, her most useful hand to be able to access her communication.
Yeah.
So is that true, or is it okay to, try to work on getting the left hand so that she, like, someone would be able to use both if something were to happen with,
Yeah.
the right hand?
So I think when it comes to communication, taking away her voice would be one thing. But let's
Yeah.
say that you really want to work on addressing that left arm to be able to reach for a preferred toy, maybe the remote to change the channel because she really wants to watch something else. I think in other times when talking as a parent, it's hard to have those structured activities at home. But I think it's really healthy to try and challenge her and do those things kind of repetitively. So let's say every Saturday, there's 10 minutes where you're working on her reaching for her favorite toy or even using that switch to access her communication device. With the left hand, but you make it structured as part of your routine so that she is successful. I think that that's wonderful. I would do that with my own child because I think that there is something to say about them trying new things and being successful and creating those pathways so that in case she can't use her right arm, she would be able to use her left arm. So,
Yeah. So yeah, I was just always like, oh, I don't know, if we should, be trying to restrict her and force her to use the other hand to work on communication, access, or just, really accessing the button.
yeah, yeah.
And,
I think it'd be a good idea
participate.
because it'd be, but I would do it at a time where you're not taking away her voice. You know
Yeah.
what I mean? If you're in the middle
Mhm.
of a conversation and she's going to answer you, I wouldn't be all of a sudden be like, okay, you have to use your left hand. I
Yeah.
think it'd be like a structured time to challenge her would be
Yeah.
very healthy and good. So,
Okay. And then, all right. So you were talking about like walking across the room
mhm.
in OT. And that is something I would be like, wait, I thought that was physical therapy. Like, what are we doing with that in OT? So
Yeah.
what does that have to do with OT?
So I would have to say that yes, primarily you would see the physical therapist working on that stuff, but you have to think in occupation-based activities. If the child really wants to be able to walk across the room to go to their playroom, then that's what we should be addressing. We should be addressing their goals that helps them live their best life. So um, I am qualified to do gross motor skills. I don't think it has to be an OT PT thing, just like I think PTs can do hand-based activities that we have hand therapists that can be PTs and stuff too. So yeah, I like to think that, it just would depend on the goals of the child and the family. And if that is what's most important to them, then we should be addressing what that that is. So.
Yeah. And so and then OTs can do like feeding too also, right? Because when she was
Mm-hmm.
in the school system, we didn't have speech doing feeding. It was the OT doing feeding. And I'm
Mm-hmm.
not sure if that is how it is with all the public schools, but that's what we had here. And I was like, what? Why is the OT doing feeding?
Yeah.
So,
Yeah, so definitely OT can address that. So if you think about the coordination of using the upper extremity to say bring the fork or the spoon to the mouth or holding that cup, I would say that the speech therapist is highly trained on swallowing, but OTs are just as much trained on feeding techniques as well. So.
Okay, yeah. And so, and then before we start talking about like how we get into, if someone is interested in your program, your intensive therapy program, and things like that,
Mhm.
I think you have something important to share with us on, maybe a little bit why you're also involved in this field and you're so dedicated and you have such a passion for being an OT and helping children and with disabilities and just all children period.
Yeah.
If you can share with the audience a little bit more about your backstory and
Sure,
your
absolutely.
family.
So I've been in OT now for 14 years, but 7 years ago I had a son, and has a disability, and so it's been a journey as a occupational therapist, but also of a mother of a child with a rare genetic disorder. It's been nuts. So I will tell you a little bit about Ethan's story. So he was born in 2016. I had an uncomplicated pregnancy, and then I ended up having a C-section just from my tailbone is actually fused, and they weren't able to manipulate him out, and so I had a C-section, emergency C-section. So he developed pretty normally until about 12 months of age. But then I noticed when he had pulled to stand, he couldn't stand independently. And I wasn't making any progress with that at home. So as a therapist, I went to my pediatrician and discussed some of this with him. I have a lovely one who I feel like I could chat with anytime I needed something. So I said to him, I was like, he's pulling to stand, but I just can't get him to stand independently. I feel like something's going on. And so as he's feeling Ethan's legs, he says to me, there's something else here. I think you're going to have to go see neurology and probably physical medicine and rehab. And so we ended up doing some MRIs. We ended up doing 3 total, nothing on the MRIs. They were clear. But neurology said they wanted to test for a genetic disorder. And it turns out that is what we have. He has. So it is hereditary spastic paraplegia. He has an unknown variant of the HSP4 gene, which is the SPAS gene. So he presented a lot like a child that has CP, diplegic CP, where his lower extremities were very tight. He ended up having selective dorsal rhizotomy, so SDR, in 2020. And then we went to the Napa Center that December, which was about 6 months after he had it, and did therapy. I learned about intensive therapy more around this time, and it really personally affected my son. And it affected me as a practitioner, like to see. So the model at Napa Center is 3 weeks, and you get 3 to 4 hours of therapy a day. And he was doing 4 hours of therapy for 3 weeks. And it was a financial commitment. It's a time commitment, a time off from work commitment. It was a lot, but it drastically changed his life. He went from using a walker to using forearm crutches, and he was able to access his school more independently, his home, everything. So I would say that was the turning point in my life. Between that and then I also, in 2019, he did a mini intensive here in Jacksonville with a guy named Jake. And Jake is the creator of DMI. And so I was able to form a friendship with him and chat, and I ended up becoming certified in DMI beginning in 2021, and worked with Jake a lot. And I've just really loved and seen so much changes in this intensive model. The more that these children are getting the consecutive sessions and input, they're making huge changes in growth. And personally, I've seen it now happen to my son twice, because we just got back from Chicago this summer. He did another intensive, to just seeing my patients change. I'm telling you, like, personally and as a therapist, it changes lives. And so that's why I want to help kids. That's why I created my business, to travel around and be with people in their homes and do this. And I just honestly feel so passionate about it. And personally, I just know that it makes a difference. And so that's what I'm trying to do.
And I mean, this is why I do this, because it's even more special when you have a therapist, a doctor, excuse me, whoever that is working with your family and your child, that is able to connect and understand, and they are not just, reading a book and doing their normal studying that they have to get done. Like, they actually have the experience and, knowledge of these different, disorders or disabilities, and they have the actual experience. It makes it so much more intimate, and just, the connection there, and knowing that the person is very, very interested in the quality of life of your child, because they have experienced it themselves. And just knowing that you have a child with a disability, and you are you're a working parent, and you're experiencing everything that we are all going through as parents with children with disabilities, is just what makes it just so amazing. And
thank you.
yeah, and then also too, there's probably parents out there that they may have a child with this genetic condition, and they might be looking for someone because they're trying to figure out answers and things like that too. So being able to make connections is so important in giving people options and a platform to let them know there's other people out here going through the same thing that you're going through, and you're not alone. And then just going back to the financial commitment, like you were talking about, the financial commitment. Do you take insurance with Blossom and Grow OT, or how does your your process work?
So I do not take insurance. I am private pay only, but I do accept Step Up for students. I know my friend Ashley from Jack's Kids Aquatics was on here, and she talked about that as well. I've also used some other foundations to help fund my patients. They've used them to help fund their intensive therapy. There's a really great foundation based in California called the Miriam Parman Foundation. They help out. There's JT Townsend. I have a link on my website with all of these foundations for families to reach out to help them pay for this and stuff. So yeah.
Awesome. And it's just like, okay, if the insurance companies actually had people approving and going through these things, if they actually had family that, or their own child that had a disability, then they would understand why it's important for their children to be able to have therapy more than once or twice a week for only 30 minutes or an hour. And they would understand that they need consistent care, and that everybody deserves quality of life. Because I'm sure, even if they, wanted to work out, you're not working out only once or twice a week. You're probably going to go work out 3 times a week. It's just things that you need to do to keep your body healthy and just moving. And I just wish that insurance would be able to be more understanding and have people that actually have experience what we are going through, and why it's so important that our children are, they need to be able to have a quality of life. Just because they don't have a voice, just because they might be limited in something, that doesn't mean that that's going to stop them from being able to accomplish, other things in life. So, I
Yeah.
really hope that that can be changed one day. And I'm so thankful that there are those foundations out there that are helping families,
Yes.
that are really committed to, doing this process of going through intensive therapies and, other programs out there, because without the foundations,
It
uh,
wouldn't be possible.
yeah,
I want to give a shout out to the JT Townsend Foundation because they actually helped
yeah.
us go to Boston for the Napa Center in 2020. And
Oh my
without
goodness.
them, it would not have been possible.
Wow.
After having SDR, we actually used all of our insurance visits for therapy because you have to go consecutively after that surgery. And they helped us get to Boston and it changed his life. And, you know, I agree. I know that me not taking insurance can be a burden on families, but I promise to work with them and try my best to help them find someone that can help them. So,
Yeah, and I can attest to the JT Townsend Foundation. They're amazing. They're amazing. And they do wonderful things for the community. Um, and so also with, getting started with Blossom and Grow, do
mhm,
they go to your website? Do they
mhm.
call? How do they get started with that? What are the qualifications? Are there certain qualifications to be able to, get started? Do they need a referral? How do you go about
Yeah.
finding your
So
clients?
if you're interested, you can reach out by Instagram. You can email me or you can go on my website. So I have 3 access points. And I would like families to know if they do want to only focus on DMI or dynamic movement intervention, that I do have a weight limit for that because it's only 40 to 45 pounds for safety for not only myself, but the child. Some of the activities do require that you pick them up, and I don't want to hurt anybody. I don't want to injure myself. I would just rather play it safe with everybody all around. As for the other if you want to work on other things, then let's chat about it. Let's talk about it. I do like to do intake paperwork, not paperwork, but more of like a chat just like this with families so that we can talk about your child's current level of function and the goals that you want to work on. So let's talk about it. If you want your child to work on using their upper extremities, or if you're working on wanting to do like electrical stimulation and really learn about that more to benefit your child, then let's do it. Let's chat. There was another part of your question in there. I think I'm forgetting. So
Just like if they need a referral to come.
oh, yes. Yes, please. I
Yeah.
do ask for a referral because I want to, if you would like a super bill to submit to your insurance after we're done to see if you can get reimbursement, which I do for families, it is required that I have a referral because I have to put the physician's name and the diagnosis code that comes from the physician. Insurance does ask for that information. So.
Okay. And I forgot to ask too. So, I know that you see pediatrics, and
Mhm.
um, do you have a lot of children that come that are, wheelchair bound?
Yeah, so I just got done with a little guy in Alabama that is in a wheelchair, actually two of them. And so yes, I mean I
Okay.
have. And you know, my son is in a wheelchair like
Okay.
for long distances and stuff. So I think it's just a mobility aid and it's really just based on goals. So
Yeah.
if you're really trying to work on something, let's chat about it and see if it's possible to make it happen. So
And then what about with the electrical stimulation? Are there any like precautions for that if a child has seizures?
It's not seizures. It would be more of a, oh
Heart.
my gosh, I'm blanking on the name. It's a stimulator for if they do have seizures.
Okay.
Hold on, it'll come to me after. I'm sorry.
It's fine. So does it like trigger the
It's kind of like a pacemaker, but it's usually
Okay.
placed in the side and it will help calm the child when they are having a seizure. It helps suppress it sometimes and stuff.
So is that something that they need to have if
No, they
that
should
is
not
a
have that. Just like
Okay, okay,
a cardiac pacemaker or
okay.
any, the only other thing would be like implanted, like hardware or something. Like you can't stimulate over that because it can be conductive. And so we want to be safe when that happens. So, oh my gosh, now it's going to bother me. I know the name of that and I'm blanking.
Yeah. Okay. And then I was going to say, because I think that we did the is NEMI, is that what you call it?
NMES, so
NMES. Okay.
neuromuscular
And
electrical stim.
okay. And so, like, especially for the kids that are nonverbal, like, is it something that it can be painful because you have to go like up and down and the numbers, like how can you tell if it's uncomfortable or is it supposed to be uncomfortable at first and then they like get used to it?
No. So when we put it on the child, we always start low. We're not going to put it on the child and like hurt them. So we would ramp it up slowly and using parameters that are appropriate for your child. And then we would watch how they respond to it. So sometimes kids will look at their arm or their leg. Sometimes they will say something. Sometimes they make noises. Even just wearing the stickers sometimes, which is the electrodes, would just be a great way for the child to get used to having the device on or near them and stuff. So.
Okay. And so I think I asked all the questions, if you guys are interested in seeing Jennifer over at Blossom and Grow OT, make sure that you visit her website, that you can go to Instagram and get in contact with her, and make sure that you get the referral from your doctor if you want to be possibly reimbursed for the insurance. And, we have these wonderful organizations out here that are willing to help you get into the intensive programs and be able to complete that program. And again, make sure you follow Blossom and Grow OT on social media. Are you on Facebook?
I am, yes.
Okay, yeah. Yeah, so on Facebook, Instagram, do you have like TikTok or anything like
Not
that?
yet. Maybe in the future.
I'm like, TikTok is a whole nother beast. So
I know. I don't know if I can edit those videos that well.
Right. So Instagram and Facebook, make sure that you go on there and follow Jennifer Blossom and Grow OT. And I hope that you guys were able to get some great information from this session and get a little better understanding about, intensive therapy versus going for your typical standard occupational therapy that you go to the outpatient clinic to receive. And if you have any other questions about the program, please make sure you contact Blossom and Grow OT. And I'm sure that Jennifer will be more than happy to answer any and all of your questions. And thank you so much, Jennifer, for coming on today. I really appreciate you coming on and sharing all this information.
Thank you,
with
Brittany.
us.
Thank you so much for having me.
Yeah. So thank you, everybody. I hope you enjoyed this episode again. And thank you for tuning in to another episode of Two Moms and Some Labels. Until then, we will see you guys next